If you have an adolescent that was just diagnosed with ADHD, we can make a huge difference in their lives.
Attention Deficit Hyperactivity Disorder is an impairment with executive functioning as well as ability to regulate attention.
So with ADHD, typically there's an impairment with executive functioning. And by executive functioning, what I mean is that that person has significant challenges with managing their time. So they may start things late, things get put off, that maybe they're not planning effectively. Sometimes we'll hear yeah, I have like 30 things started, but of those, none of those things are completed. That's very, very classic with ADHD.
Some of the most common things that are reported in patients I'm seeing with ADHD, whether it's adolescents or adults, is this disconnect. And when I'm talking about this disconnect, I mean, here are this person's skills. Here's their intellectual capabilities, and here's how they feel they're performing every single day, where there's this disconnect between what they know and what they're able to show they know, which is what we're talking about when we're addressing executive functioning with ADHD.
Executive functioning takes what you know, cognition, and then puts it into action, and that is the difference. Executive functioning is more of that functional, in the moment, making it happen, carrying through with the things that you intended to complete.
Many of our patients look perfectly normal. There's nothing about them if they were walking down the street that would tell you that they have a difficulty.
So I've worked with a lot of college students who either have a brain injury or ADHD, and when you think about the demands of college, there's so many things that you need to factor in and keep going at the exact same time. And when you have impairments with executive functioning, so that's more of that time management, initiating things when they need to be started, planning, organization, that's really hard.
There are also many people with ADHD who are athletes who struggle to maintain the academic performance that they need to stay involved in the sports without being put on academic probations or benched because of the impairments that they have in especially the executive functioning skills or attention that needs to be in place to be successful in school. And that's something that we very, very commonly help with.
When we can help someone with ADHD and they're still an adolescent, it's great because we can make some nice changes in that person's lives. If that person goes through to their adulthood, we can still make some huge changes in that person's life.
It's not uncommon for someone to not be diagnosed with ADHD or not be diagnosed until adulthood. You know, for instance, I think about here at our clinic, Progressive Therapy Associates, we've had some adolescents that are referred by their primary doctor and they're here because of difficulties they're having. And it's not till that point that their parent is recognizing all of these characteristics are also matching up for me, and I think that I might also have ADHD. So it's not uncommon that individuals won't be diagnosed until adulthood with ADHD.
So when a person has ADHD, oftentimes they're prescribed a medication, and that can do a really good thing for that person in the sense that it helps with their attention abilities and their ability to maybe control impulses. So maybe they're not saying or doing things as impulsively. But the thing that I don't see happen typically is that it helps with the executive function piece. And by that I mean the ability to manage your time effectively, to initiate tasks when they need to be initiated, to really recognize the passage of time, to remember the right thing at the right time. Medications don't help with those skills, and that's really the service that we provide.
With ADHD, medications are great. We're not doctors, we don't prescribe medications, but medications can work really well for some people. The key though is medications don't build skills. Pills don't equal skills. So if your brain never had skills, so the case with ADHD, or if your brain lost skills, the case with traumatic brain injury, your brain needs help rebuilding those skills or learning new skills. And medications can give you that.
So if you're wondering if our services could be of help to you, just give us a call. We will help you to figure out if what we provide is a match, and we'll let you know if it isn't.
Progressive Therapy Associates.